Bismillah ar-Rahman ar-Rahim. My presentation in this session is about real-world safety and effectiveness of iGlarLixi, the fixed ratio combination of insulin glargine together with GLP-1 receptor agonist, lexinatide, in people with type 2 diabetes who fast during Ramadan, the Soliram observational study. Most Muslims with type 2 diabetes fast during Ramadan. In some studies, more than 85% of these individuals fast more than 15 days, and some studies done in our ASD, 98% of the patients intend to fast the whole duration of Ramadan. So Ramadan fasting is popular for Muslim populations. However, the incidence of hypoglycemia increased during Ramadan compared with pre-Ramadan, as observed in the Dar-Mina study, and I had the honor to be one of the co-authors in this study. So treatment adjustment must be considered to prevent severe hypoglycemia. The Lexiram randomized control trial previously proved that combination of both separate administration of basal insulin and lexinatide allowed adults with type 2 diabetes to fast safely during Ramadan. So in Lexiram trial, we used the insulin glargine together with the lexinatide separately administered, but in Soliram study, there is use of fixed ratio combination of both molecules. And this is a study design. It is multi-center, multinational, prospective, non-interventional study, single-arm study, and real-world observational study. It was conducted in two waves, one wave during Ramadan 2020 and another wave in Ramadan 2021. The population were adults, type 2 diabetes treated with iGlarLixi, which is the fixed ratio combination of insulin glargine 100 together with lexinatide for 3 months before Ramadan, and then for the holy month of Ramadan for 1 month, then 1 month after Ramadan. There was adjustment of iGlarLixi, and the primary objective was proportion of participants experiencing at least one documented hypoglycemia, less than 70 milligram per deciliter blood glucose, and or severe hypoglycemia, symptomatic hypoglycemic event during pre-Ramadan, Ramadan, and post-Ramadan period. The participants were 420 candidates from 9 countries, and those were the baseline characteristics of the patients. The age, the female ratio 44%, the BMI 30, mean BMI 30, and the diabetes duration also mean diabetes duration 12 years. And what was important is the baseline hemoglobin A1C, which was 8.2 hemoglobin A1C. The time of injection was variable in different countries according to the tradition in the country and the recommendation in the country. Most injections of the fixed ratio combination was before breakfast or at breakfast time, and then followed by lunchtime. This is the drugs used together with the combination of lexinatide or iGlarLixi. There was biguanides, sulfonyl ureas, SGLT2 inhibitors in combination with the fixed ratio combination, the iGlarLixi. Most participants injected iGlarLixi in the evening with the iftar time. And those were the number of days fasted by the participants, and the mean number of fasting days in this study was 28.8 days. Then they fasted almost the whole duration of Ramadan. 92% of the participants did not break their fasting during the holy Ramadan period. And there was 31 participants who did break their fasting, and the reasons were different. Some reasons were not related to the medication at all, like those who were traveling or those having menstruation in females, or those having pre-existing conditions. The number was 7 or 22% of those who had break the fasting. And only 4 patients break the fast due to adverse events. The primary endpoint was the incidence of documented hypoglycemia less than 70 milligram per deciliter, symptomatic and or severe hypoglycemic event. And this was really very low incidence in hypoglycemia occurrence. 1% had hypoglycemic event during the last month before Ramadan. 2.3%, which is 9 patients, had hypoglycemic event during Ramadan months, and 1 patient out of 380 patients who completed the study had hypoglycemia first month post-Ramadan. So the hypoglycemia was low in incidence throughout the whole study, even during the fasting hours in Ramadan. There was changes in hemoglobin A1C in favor of the use of fixed ratio combination. Let me remind you that the baseline hemoglobin A1C was 8.2% before Ramadan. By the end of Ramadan, the hemoglobin A1C, the mean hemoglobin A1C was 7.5, so there was reduction of 0.75% hemoglobin A1C, and this is really a remarkable result. Proportion of patients reaching hemoglobin A1C less than 7%, there was 28% of the patients who reached target hemoglobin A1C of less than 7% by the end of Ramadan. Also, there was changes in fasting plasma glucose and also body weight, and fasting plasma glucose dropped from pre-Ramadan mean fasting plasma glucose of 140 milligram per deciliter to 121 milligram per deciliter by the end of the study. Again, there was reduction in weight between the two situations, before Ramadan to after Ramadan, about 1 kilogram. And these were the adverse events. Any adverse event, 20. Any serious adverse event, 0. Any treatment-related adverse event, 0. Any adverse event leading to permanent treatment discontinuation, only 1 case out of around 400 cases. Any adverse event leading to death, 0. And those were the adverse events, gastrointestinal adverse events reported in 4 patients, 0.9% of cases. The adverse events leading to discontinuations was asthenia, and treatment was stopped by the patient. No adverse events was considered related to iGlarLixi treatment, and no serious adverse events were reported. These were the conclusions of this study in this observational, multicentric, prospective real-world study. It included patients with type 2 diabetes, around 400 patients from diverse regions. 90% of participants treated with iGlarLixi were able to fast the entire month of Ramadan. Few patients or few participants in this study, 2.3%, had documented hypoglycemia less than 70 milligram per deciliter or severe hypoglycemia during Ramadan. No participant experienced severe hypoglycemia. There was minimal adjustment to anti-hyperglycemic regime, and glycemic control was maintained during Ramadan, and we had reduction in hemoglobin A1C of 0.75%, which is really remarkable. And the conclusion is iGlarLixi may provide a safe and effective treatment option for people with type 2 diabetes who intend to fast during Ramadan, and make it simple and effective with the fixed ratio combination. And thank you very much.